Welcome to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on innovative medicine. I'm your host, Ashley Russo, and we have a unique show for you tonight. We're talking about innovations in imaging at St. Luke's University Health Network. We'll be joined by a talented panel of experts from the field. Stay tuned. This is St. Luke's Health Now. Coming up on this episode of Health Now, an in-depth look at innovations in imaging at St. Luke's University Health Network. Stay tuned. Thanks for joining us. Let's get started. We have an accomplished panel of guests joining us tonight. Up first, we have Dr. David Furman. He serves as Section Chief of Computed Tomography at St. Luke's University Health Network. A board-certified radiologist with a fellowship in cross-sectional imaging, Dr. Furman guided the CT department toward the most progressive technologies and techniques in radiation dose reduction. Dr. Furman received his medical degree from the Lewis Katz School of Medicine at Temple University in Philadelphia and completed his residency and fellowship at Mount Sinai Hospital in New York City. Thanks for being here, Dr. Furman.
Thanks for having me.
So tell me why you went into this field and why specifically CAT scan?
Well, I was really excited by CAT scan when I was in my fellowship at Mount Sinai. I got to work with a physician who was one of the first using CAT scan to diagnose aneurysms of the brain when it used to have to be done with a digital subtraction angiography. So I could see where CT was going to be able to make diagnoses that used to be more invasive, but in a non-invasive way. So that was so exciting to me that I just kind of kept with it.
And amazing to train with someone who kind of revolutionized the field and then see where you're able to take it today. Joining our panel next is Dr. Robert Fournier, who serves as Vice Chairman, Department of Radiology at St. Luke's. He received his medical degree from Georgetown University in Washington, D.C. He completed his residency in diagnostic radiology at the University of Maryland and his fellowship in nuclear medicine at the Hospital of the University of Pennsylvania in Philadelphia. He's board certified by the American Board of Radiology and the American Board of Nuclear Medicine. Thanks for being here, Dr. Fournier.
Thanks for having me, Ashley.
So tell me how excited you are to be able to introduce these technologies to all the bright, curious, new diagnostic radiologists you get to work with every day.
This is such a unique place because we will deploy 22 of these CT scanners across our network and have all of this technology throughout every one of our hospitals. We trained in our different residency programs. We had varying levels of technology, but now we have this kind of uniform product which all of our residents can learn and play with.
Let's meet our final panelist, Dr. Joseph Busich. He received his medical degree from Jefferson Medical College and completed his residency in diagnostic radiology and fellowship in body imaging at Thomas Jefferson University Hospital in Philadelphia. Dr. Busich specializes in women's imaging, including breast biopsies and minimally invasive ultrasound techniques used to identify fibroids or polyps inside the uterus. He's board certified by the American Board of Radiology. Thanks for being here, Dr. Busich.
Thank you, Ashley, for having me.
Women's imaging has come a really long way, and we're saving so many more lives with early detection. What gives you the most satisfaction in what you do?
So I've been doing this for 25 years this year in July, which is pretty incredible. When I started as a body imager, as a body fellowship, MRI was brand new for breast imaging. We were just doing all the new research, figuring out the new sequences we could use to better women for breast cancer. We've come so far in those 25 years. We're now using breast MRI for a screening exam. We're now using contrast mammography, something that I've never thought would even happen for the past 5 years. It's pretty incredible how far we've come. As far as pelvic imaging for women, using sonohysterography, minimally invasive, giving women answers, finding early cancers. That's why I keep doing this, finding early cancers in our wives and our mothers and our sisters and our daughters. It's pretty amazing. I get to do this every day.
It is really incredible, and thank you all for giving us some background information and telling us why you do what you do. Up next, we'll dig deeper into innovations in imaging at St. Luke's. Stay tuned. We'll be back after a short break. You're watching St. Luke's Health Now.
St. Luke's continues to make sure patients always have access to leading medical technologies, no matter where they receive their St. Luke's care. St. Luke's recently cut the ribbon on a fleet of the most advanced ultrasound technologies from GE Healthcare, raising the bar of imaging and ultrasound to a level not seen in the U.S., creating consistency in radiology, vascular, and cardiology services throughout the network.
As we've absorbed some neighboring hospitals, we've inherited various ultrasound equipment from different vendors with different levels of age and ability. It was important for St. Luke's to make this investment. It doesn't just benefit radiology. This benefits multiple departments. It's used all over the hospital. One of the fundamental problems is being able to interpret these different various equipment and various vendors. Comparing it becomes an apples to oranges kind of a thing, and it's a struggle. The real goal here was to try and obtain some level of uniformity. By uniforming it, will make it easier to make it more efficient and more streamlined. Most people, when they think about ultrasound, think of that happy pregnancy ultrasound for obstetrics, but ultrasound's much more than that. Ultrasound is great for the whole body, and the real benefit with ultrasound too is that there's no radiation like with CT and X-ray, and also it's one of the only imaging modalities that we can take to the patient. These machines are designed to streamline their activity, to push less buttons, to adjust and tweak the images less because the machines are doing it for them. We'll also have better accuracy, hopefully, with the better imaging quality. There will also be new technologies that we didn't previously have in the Valley, so there'll be new tests and new things that we'll be able to do with this equipment. With this network-wide upgrade, patients can go anywhere and be confident that they'll get the same level of imaging and the same accuracy and access to technology.
Welcome back. Thanks for being with us tonight. I'm Ashley Russo, and this is Health Now. We want to thank our viewers for watching our program tonight and for providing us with questions for our panel, which we will get to later in the show. Joining me is a talented group of medical professionals, Dr. David Furman, Dr. Robert Fournier, and Dr. Joseph Busich. We've learned about your expertise. Now I want to dig deeper into some of the services that are available at St. Luke's. So, Dr. Busich, I'll start with you. What are some of the advancements in imaging for women, and what does it mean for them?
Number one, and most importantly, 3D mammography, basically using tomosynthesis, which is a 3D technique, to find very small breast cancers that sometimes get hidden in very dense breast tissue. We've been using 3D mammography at St. Luke's for approximately 10 years. It's brought women very far in diagnosis for breast cancer. It finds between 25 to 40% more cancers at an early stage using the 3D technique. We have that at St. Luke's for every one of our patients. We have something called ABIS, which is automated breast ultrasound. Essentially, we scan the entire breast and do 3D reconstructions to look for small cancers that we may not see in mammography, even 3D mammography. One of our newest techniques is called contrast mammography. Essentially, the patient is given contrast in their arm just like they would for a CT, and then we take a mammogram, look for anything that's enhancing or lighting up. This has been an amazing technique to find very small cancers at an early stage, and also to eliminate things that may look like cancer but actually aren't cancer. Once we see that doesn't enhance, the patients can go back to the regular screening schedule, and it's just been really incredible technique.
To know that there's 3D mammography across the entire network is astounding, but all these other technologies, really incredible stuff. Dr. Fournier, talking about advancements, what will St. Luke's radiology residents and med students learn over the course of their residency? You've been teaching med students now for almost a decade, and now there's a residency. Tell us more about that.
Radiology is a very different field. We actually call it becoming the doctor's doctor. We're physician-facing. And so the residency program is meant to train these residents to kind of look at the images and interpret them in a clinical scenario to give the clinician guidance as to what to do next. They actually translate what they're seeing in that image into a report to help that particular patient. So over the course of their residency, they kind of learn each little modality by what we call little packets. So they will learn musculoskeletal radiology. They will learn what the joints and the muscles and the tendons all look like as normal, and then as abnormal in pathology. In the next month, they'll rotate to something different. And again, learn that as a different skill over the course of their first year, and then start repeating it during their second year. As they go down that course of their training, they get more independent. So they'll start learning on their own and reporting back to an attending. You think what medical knowledge is doing? It's doubling every several months. Trying to become a resident today is much more difficult than it was for us 2 decades ago, because the amount of knowledge we have to know has grown significantly.
It is astounding, and you're mentioning the technology changing. You know, Dr. Furman, you talked about CT and your interest in it. How has this technology evolved over the years? What was a CT scan 30 years ago versus what is it today?
CT technology is one of the most rapidly advancing fields in radiology, and the main thing that has become better is the speed of the scanner. So originally in the late 1960s and early 1970s, when CT scans first began being used for patients, it might take 45 minutes to an hour to scan just the head. And now we're at a point where our new scanner can scan the entire chest, abdomen, pelvis. The one we have at Upper Bucks can scan the whole chest, abdomen, pelvis in about 3.5 seconds. You know, it has to do with the explosion in computing power, but also the engineering techniques that are used in creating the scanners. And today we're having even greater expansion in the technology, mostly because of the advent of AI and deep learning technologies that helps the software, the computer part of the CT scanner, take the images and make them better with less radiation.
That's amazing. Another great advancement, Dr. Busich, has been in St. Luke's women's imaging and really pioneering the concept of regional breast centers. Tell me what that is and how does this improve the care for women who need diagnostic or follow-up imaging?
Sure. So we have 3 regional breast centers across St. Luke's, and they are teamed by our technologists and our radiologists who are at the top of their field. Women will have a screening exam on an outside site. If they need to be called back and have diagnostic workup, they come to one of these 3 centers, and then we do diagnostic imaging for them there with the expertise and all the equipment that we have to find these small breast cancers. Before the woman leaves from the regional breast centers, they are given a diagnosis. They know exactly what their next step will be. If they need a biopsy, we discuss that with them as well. But again, this is across the 3 centers that we have at St. Luke's, and they're manned by our top technologists and our physicians.
You know, Dr. Fournier, that brings up something interesting for residents. You talked earlier about some of the skills they will learn, but what about those soft skills? How well prepared will they be to go into practicing radiology? And how important is that physician-patient interaction?
Huge. You know, radiologists, I say, we're not particularly patient-facing. In 2 particular areas, women's imaging, they still really are. Nuclear medicine, they're still really patient-facing. But to learn those softer skills I think St. Luke's is really poised to do this well. We're going to have hands-on. In essence, the resident will be working with the patient and the attending in a one-on-one fashion. No fellows intervening. It'll be a higher quality program. So when they come out, I call it producing a quality product, which is a high-quality radiologist who has those softer skills. And again, it's not just learning radiology, it's learning all different facets of radiology. You mentioned AI is coming, it's coming at us in a big bad way. They're going to be responsible for that. They have to understand physics. They have to understand informatics. How do you get an image from a CAT scanner to a workstation that may be in California? So all these kind of components all come together, and I think St. Luke's is really poised, and we invested heavily into this residency program to learn those skills.
There's so much for them to learn, and dealing with those patient questions is a big part of that. And Dr. Furman, I know one of those questions tends to be on the radiation levels, that exposure. And I know that you've been able to achieve lower doses at St. Luke's. Tell me how that's done, and how can patients feel good about needing a study that does expose them to radiation?
Sure, and radiation is an extremely complex topic that's kind of hard to address in a way that patients understand and feel comfortable with. But what's most important to know from our perspective is that less radiation is always better. And that is something that we as a group of radiologists and as a network are strongly committed to. So it's partly the radiologists who make sure that we only scan what we need to scan to get the diagnosis, and partly the commitment of management of St. Luke's to get the best equipment where we have the most modern CT scanners that have all the software that keeps the radiation dose low.
Great information from everybody here, but we're not done yet. After the break, we'll learn more about new technologies and services at St. Luke's University Health Network. You're watching St. Luke's Health Now. Stay tuned.
St. Luke's has been a cornerstone of the Lehigh Valley for over 150 years. It was originally founded to provide industrial workers with immediate local access to care. In the last century and a half, while healthcare has transformed dramatically, St. Luke's dedicated physicians, employees, and volunteers have proven they can respond to changes with exciting, innovative, and bold healthcare solutions. St. Luke's ability to deliver the highest quality care at the lowest cost is truly transformational and will ensure our future.
St. Luke's worked with GE Healthcare and Premier Applied Science to develop the nation's first one-stop breast clinic It allows us to provide all imaging in one day and provide any necessary biopsies during the same visit, receiving final results in 48 hours or less.
Being able to take a woman through this process as quickly as possible has been a foundational principle of our departments. We do everything we can to reduce a woman's anxiety around this.
The St. Luke's Regional Breast Center offers the most advanced technology, including contrast-enhanced mammography. The beauty of contrast-enhanced mammography is that it is very sensitive for detecting breast cancers. It is also very useful in that things that are not breast cancer tend to not enhance. So it gives us both the leverage of detecting cancer and also identifying things that are not cancer as such.
Since COVID, wait times around all of women's imaging have increased. So having the one-stop breast clinic and being able to bring a patient through the whole process so quickly is the greatest feeling in the world.
The traditional model of delivering breast care can lead to an overall wait time of approximately 26 days or longer. The one-stop breast clinic was developed at St. Luke's to reflect our commitment to providing outstanding patient care.
Every single member of our team is so committed and so passionate about the work that they do. It's hard to come in every single day and be looking for that cancer. We don't ever want to find it. But if we are going to find it, we want to find it as early as possible, and we want to support our patients and bring them through the process, because regardless of whatever their diagnostic outcome is, we want them to have a great experience. We want them to know that they are supported and they are not walking through this alone.
Welcome back to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on innovative medicine. I'm your host, Ashley Russo, and we have an interesting show for you tonight. We're talking innovations in imaging at St. Luke's. In case you're just tuning in, I'm joined by three St. Luke's medical professionals, Dr. David Furman, Dr. Robert Fournier, and Dr. Joseph Busich. Thanks for being here tonight. In the first part of the program, you told us a little bit about your expertise and why you went into this field. Then we talked a little bit about the technology, but now we want to do an even deeper dive. So I'm going to start with you, Dr. Furman. As a part of the partnership with GE Healthcare, St. Luke's has a great long-standing relationship there. There's been a huge investment in CT technology. What are the benefits to the St. Luke's network and to the patients in our community by investing in CT? Is every CT machine the same?
No, definitely. Every CT is not the same. And I think that's what's so great about St. Luke's entering into this very large commitment to get a uniform fleet of CT scanners across the St. Luke's network. So over the next 4 to 5 years, all of our scanners are going to be replaced with the most modern scanners. And probably the most exciting part is that we have agreed to enter into a subscription service deal with GE, and what that does is that anything new that comes out that is something that GE is going to offer to their other customers will come to us. So we'll always have the most modern technology, whether that's software or hardware, to have the lowest radiation dose and the fastest scans.
Really good news for patients, but maybe challenging news for residents, right? So they get that access, Dr. Fournier, they have these resources and access to amazing cutting-edge technology. How does this make a difference during their training and maybe the choices of choosing to stay at St. Luke's for their practice or going somewhere else?
Well, this is a huge attractant. You have to think, how many networks in the country have done this? 0. This is the largest deal GE's ever done in the world, putting these CT scanners in. From a resident's perspective, think of what we know about the CT scanners today. We know this much. The resident's going to have the opportunity to look at these scanners, ultrasound systems, x-ray systems, mammo systems, and say, we can do better because we can now apply it to this new pathology or this new disease state. So I think our residents are going to really learn from this system, and people in the Valley are going to learn from our residents because they're going to keep challenging what the systems can do.
Dr. Busich, St. Luke's partnered with Premier Applied Science and GE to really be the first in the nation to add a one-stop breast clinic, and this is really rapid diagnosis and treatment. Tell me about this model and what does it mean for women?
So the average wait time for a woman from diagnosis to biopsy to results to meeting with a surgeon is approximately 23 days across the country. We do it in 48 hours, and it's pretty incredible.
Which is a really big difference. We're talking about
It's a really big difference.
3 weeks basically, plus
Correct.
3.5 weeks,
Correct.
down to 2 days.
2 days. So what we do is that we have women who are flagged by their surgeons, by their oncologists. The radiologists will see the case and will say, this patient is a great patient for the one-stop clinic. They immediately are given an appointment on their one-stop clinic days. They come for their diagnosis, meaning they have their diagnostic workup. Whether it's a 3D mammogram, whether it's contrast, whether it's an ultrasound, that's all done the same day. We find what needs to be biopsied, that is done the same day, and the results come back in 48 hours.
You mentioned contrast-enhanced mammography. What are the benefits there, and why is this important for patients to know that that's available to them?
When women have dense breasts, and 47% of American women have dense breast tissue, breast cancer can get lost in all the dense tissue. And also, you can overcall things that normal tissue may look like cancer. Contrast mammography helps to delineate something that's enhancing, meaning this is likely a cancer or not. If a woman comes for a contrast mammogram and the area that was in question does not enhance, we can tell you with confidence that is not a cancer. We can find very small lesions that we can't see on routine 3D mammography with the contrast. So we are finding smaller lesions because of the contrast.
So new technologies, but also new applications for older technologies. Absolutely. That's amazing. Speaking of new technologies, Dr. Furman, I want to ask you about new CT systems. They have something called dual energy technology. What does this mean, and why is it so important?
Basically, CT scanners were able to see inside the body the different densities that are inside the body. Dual energy CT allows us to see not just the different densities, but also the different molecules. So when we inject contrast, iodine contrast, we can now subtract it out, or we can look at just the contrast. And so if you normally would have had to have a CT where you would get no contrast and contrast, now we can just do the one. So there's less radiation dose. If there is a cancer, it will be more obvious because we can look at just the iodine. This is the kind of technology that our residents are going to come out knowing how to use.
It's truly amazing. It really is. Dr. Fournier, you mentioned the residents' opportunity to learn about new technologies, the opportunity to learn about patient care. But what about research, community outreach, advocacy, things that are so important to St. Luke's and to our community and to the residents coming up? What are those kinds of opportunities?
What I really love about the GE relationship, they drop off equipment and let us play with it. The residents are going to just take over that role, play with the systems, tell them what they like about it, what the enhancements for each one of those systems are, and feed that back to the GE engineers, keep making these products better and better. In terms of advocacy, we actually have the ability to kind of use our residents to help promote our women's imaging program. We currently have a risk model that we've kind of taken out of the box to give every woman the risk factor for breast cancer. That's pretty standard, but I will tell you it needs to be tweaked. So the residents will have the opportunity to kind of build that system better.
Excellent. It's amazing what is out there, what patients have access to, and what you guys are doing every day at St. Luke's. Thank you so much for such an engaging conversation. Up next, we've got questions from our viewers. Stick with us. You're watching St. Luke's Health Now.
Interested in a medical career? Consider St. Luke's if you want to be a doctor or a nurse. Based in Bethlehem, Pennsylvania, we are the area's only 4-year medical school and the largest provider of medical residencies and fellowships, and the country's longest-running school of nursing, trained at an organization that is nationally recognized in education, patient care, and quality. See why we are ranked the nation's #1 teaching hospital. Where you train matters. The best doctors and nurses train at the best hospitals. St. Luke's University Health Network.
Welcome back to St. Luke's Health Now. I'm your host, Ashley Russo. A special thank you to our outstanding panelists. We've had a great conversation about innovative imaging technology at St. Luke's. So now we're going to get some questions from our viewers. You ready? All right, here we go. I have been scheduled for a CT scan for a back injury. What is the difference between a CT scan and an MRI, and how do you know which one to choose? Dr. Furman?
You know, a CT scan, because it just tells the differences between the densities inside the body, it's great for bones. So bones have a lot of calcium in them. So when you think you might have a fracture or there might be some bony problem, then you definitely want to go ahead and have a CT scan. MRI, it differentiates soft tissues and water better. So inside the spinal canal, if you're looking there, or if you're looking at the disc material, which is not calcified, then you might want an MRI. So depending on your symptoms, your doctor is going to know what the right test is. And something that we do all the time, when your doctor's not sure, they call us up and we say, well, what can we do to best find out the right answer?
And sometimes you have to be patient, right? It's a process.
Yeah, it's a process.
All right, Dr. Fournier, I think this one is for you. My son is in medical school and is considering becoming a radiologist. How difficult or competitive is it to get into a radiology residency program?
It's actually fairly competitive these days. It's one of probably the top 3 residencies to get into. Why? Because the number of residency slots has not changed in a decade. And that's going to be a challenge for this country because we're so short. It's also been very sought after because of what we do. You're very technology driven, we're very AI focused, and that makes it very attractive for us. So we've been kind of on the top list for people to kind of join into radiology.
All right, Dr. Busich, I think this is for you. I've been getting mammograms for a long time. How much better are mammograms in detecting breast cancer today than they were 10, 20, even 30 years ago? And do you expect this technology will keep improving?
So 20 years ago, a mammogram was done. We call it 2D mammography. You get 4 images of your breasts, and that was pretty much it. Radiologists would review it, and we go from there. 10 years ago, we incorporated 3D mammography. So now we don't get just 1 image per breast, we get hundreds per breast. And then we look through all of these images looking for small cancers. So our detection rate has increased between 25 and 40% with the advent of 3D mammography, which is pretty incredible. In the future, where I see this going, well, we talked about contrast-enhanced mammography, that will probably become a screening study, I would hope, within the next 10 years. Also AI, using AI for 3D technology is on the cusp right now. So again, we use AI in mammography every day when we look at the images, but this will be for 3D technique.
All right, Dr. Furman, this is a great question, one that I have too. You started to answer it, but let's get into it a little bit more. How long does a CT scan take, and why do you need to drink contrast before your exam?
In certain situations, when you're having a scan that's going to include your abdomen and pelvis, we ask you to drink contrast before. And the reason is that contrast has this iodine in it, or barium, has a high molecular weight structure, and it looks very different than your normal tissues inside your body. So the same reason we might inject IV contrast into your arm, which will light up inside the vessels, we're going to be able to see the difference between what's inside your stomach and your small intestines and what's everything else that's in there. The scan itself is usually very fast, especially now. The scan's going to be 15 seconds, each part during the scan, but the appointment will be 15 minutes.
All right, Dr. Fournier, it takes a lot of schooling to become a physician. What further training will a resident need following a radiology residency?
So residency gets you kind of the basics, is what I call it. The basic fundamentals of radiology is what you learn. Since we kind of talked earlier about the large volume of data you have to understand and process as a radiologist, most radiologists go on to do a fellowship year, which is a focused year of training in one particular space, like he did body imaging. You understand that field extremely well, and that becomes really your focus of your career. Most fellowships are a year, neuro is 2 years, and then if you want to do an interventional year on top of that, could be an additional year too.
I'm certainly glad my physicians have that kind of training. All right, Dr. Busich, last question is for you. I was told I have dense breast tissue. How effective will mammography be for me?
What we know is 47% of American women have dense breast tissue. And dense breast tissue, number 1, it can hide small cancers. Number 2, you can overcall things in the dense breast tissue. 3D mammography really helps us to identify these small cancers before you can feel it, before we can see it anywhere else. The 3D mammography really helps us with that. The average American woman has a 12 to 13% risk of developing breast cancer throughout her entire lifetime. So we look at the risk factors, we determine where you fall. If you're a medium risk patient, you may do well with a supplemental imaging called ABIS, which is automated breast ultrasound. If you have a high risk, we call that above 20% risk. Those women do very well with supplemental breast MRI. So we have a lot of tools in our kit that we can use to help supplement when women have dense breasts.
Thank you all for your expertise in explaining all of this to us. It can be confusing, but I think it's wonderful for people to know that this technology and these specialists exist at St. Luke's. So thank you for joining me.
Thanks, Ashley.
Thanks for having us.
For more information on innovations in imaging at St. Luke's University Health Network, please visit their website at sluhn.org or call 1-866-ST. Luke's. I'm Ashley Russo. This is St. Luke's Health Now. Thanks for tuning in. Until next time, be well, and remember, it's important to focus on your health now.